because it's also tiny that when I throw it in my mouth, I end up throwing it away. It falls off, and so I'll be looking for it. So I don't even bother taking it sometimes. But that was a risky thing to do. Very risky. Why is it risky? It's risky because the folic acid actually prevents what we call neural defect in pregnant women. What do we mean by neural defect? The neural tube, the tube starting from your brain down to your spinal cord, is called the neural tube. Now, that very tube is so delicate that it is formed within the first and the third week of pregnancy. Now, if you don't take this folic acid and you don't have enough concentration of it in your blood, as the neural tube is being formed, there could be a defect that will arise, forming what we call the spinal bifida in the baby. Now, the truth is, spinal bifida in the baby is a very serious congenital defect. You won't want to have that. Nobody wants to have that. But you can prevent it. You can prevent it by taking the folic acid. It's actually advisable that you start taking the folic acid before you get pregnant. For every woman within the childbearing age, if you know you are expecting to be pregnant anytime soon, please start taking the folic acid. It's important. It's just 1 a day, 5 milligram, 1 a day. You can take that for as long as you are expecting pregnancy. It's not a fertility drug, but it helps prepare your body helps prepare you for the pregnancy, so that you have enough of it concentrated in your blood even before the baby comes, because the function is needed very early in the pregnancy. For some women that are waiting to be pregnant before they start, sometimes you may not even know you are pregnant. 2 weeks after, you don't know you're pregnant. 3 weeks after, you don't know you're pregnant. You can only know maybe when the symptoms have started coming. I'm feeling somehow, I'm just sleeping anyhow. What's wrong? I don't understand. These early morning fevers, I don't know how I'm feeling. I'm just tired. Anything I get tired, so let me go and get myself tested. You get yourself tested and the doctor is telling you, madam, you are 6 weeks pregnant. Can you see? You've already bypassed the time, the most delicate period when the folic acid needed to work on your baby. So that's why it's important for you. Once you know you're an expectant mother, you want to get pregnant, please start taking the folic acid. And if you miss your period for a day, please don't wait. Start taking your period even before your urine test or blood test confirms that you are pregnant, so that this first 3 weeks will not just go like that without you having the folic acid, because the baby will not wait for you. The formation of the baby will not wait. While you're yet to confirm your pregnancy, the baby is already being formed. And when we talk of spinal bifida, which is what the folic acid is meant to prevent, is that there is something that looks like a curve at the back of the baby. And as you give birth to the baby, you see that curve there. In most cases, they take the child for surgery immediately to correct it. But sometimes I've seen a baby that up till now, even after correcting it surgically, up till now, the baby cannot still walk. That baby is like 8 years now, but cannot still walk. The mother keeps carrying the child from place to place to go and pull, to go and do everything she can, because from here down is paralyzed. We know that any injury to the spinal cord leads to paralysis. So that's how dangerous it is. And what are we saying? We are only advising that you take your folic acid seriously. Thank you.